Hi, my name is Carrie Aborn. I'm the director of the Center for Career Development at Curry College. And we are doing our Look Who's Hiring session tonight with Fresenius Kidney Care. And we have two representatives from Fresenius with us here tonight. We have Amanda Christians, who is the lead campus recruiter. And we have Randall Blackie, who is the senior manager for clinical education for New England and for Western New York. So welcome to both of you. Thank you for being here with us. Can you tell us more about what Fresenius has to offer?
Yes. Hello, everyone. My name is Amanda, and I'm here with Randall. I've got a little bit of a presentation here, and within that, we can talk about some opportunities. So, Carrie, am I able to take it from here?
Take it from here.
Alrighty, sounds great. All right, so throughout the presentation, you might have nursing related questions, nephrology, dialysis, anything whatsoever on your mind. Feel free to put that in the chat. I might review it as we go, but definitely at the end, we will take a look. All right, so $1 million question here, what is dialysis? And I will pass it to Randall, who is a nurse, and he will give us a brief explanation.
So in its simplest form, dialysis is renal replacement therapy. So essentially we're replacing the function of the kidneys. And so there's a couple different modalities. There's peritoneal, there's hemo. Ultimately, it's just two different ways of replacing that renal function and performing the functions of the kidney for the patients.
Excellent, thank you. So Fresenius, we're kind of a difficult name to say, but we're a big company. So we are the world's leading renal therapy company. We're focused on delivering the highest quality for renal and chronic conditions. We are vertically integrated. So we started with a dialysis machine, and then we sort of worked our way into a $17 billion global company. So using the chat box here, I'm going to take some guesses or just a little bit of engagement here. So if everybody could pull up their chat, what percentage do you all think that dialysis machines in the world are Fresenius machines? So our competitors, just throw out a percentage in that chat here. And while you're doing that, I'll review some information on Fresenius. So just for North America, we provide treatments to over 200,000 patients. This number actually, even since last year, is much more than that. It's about 2,700. Just in North America, we provide 25 million hemodialysis treatments. And then in the world, it's actually in the 50 million mark. We're in 50 states and territories. That includes Guam and Puerto Rico. In just North America, we're at 67,000 employees. Globally, we're 120,000. And we have some really good guesses here. We've got 80, 60, 43, 80. Well, Randall, they're giving us really good props here. So we're about 50% of dialysis machines in the US are owned and operated by Fresenius. And we love bragging and letting everybody know that our competitor that is DaVita, they even use our machines as well. So if some of you have been in a hospital environment, I know some of you are already nurses, maybe you're a CNA, more than likely the dialysis machine that you've seen is owned by Fresenius. So here's some opportunities that we have. We're going to go ahead and use the chat feature again. So how many of you, and I know we got some nurses here, how many of you have seen a dialysis treatment or have seen or even treated a dialysis patient? Maybe you know somebody in your personal life, maybe you worked with somebody, maybe you were on like a renal floor, maybe in school you did a clinical rotation. So using that chat feature, let me know if you've had any exposure to dialysis patients. And while you are responding in the chat, I am going to pass it off to Randall. So Randall, a little bit of brief overview. These are our 3 modalities or types of dialysis. So Randall, I will pass it over to you.
Thanks, Amanda. So yeah, you can see here on the slide that as far as the delivery of renal replacement therapy, it happens in one of these 3 settings. So there's the chronic outpatient setting, there's the home therapy setting, which obviously takes place in the home, and then there's the acute in the hospital setting. So we provide services in all 3 of those venues, if you will, and are always looking for nurses to help support each one of those different arenas. The job of the nurse varies slightly depending on the setting, but ultimately when it comes to renal replacement and nephrology nursing, typically it's pretty similar as far as what we're trying to accomplish with the patient, whether it's in the clinic, in the patient's home, or in the hospital. You know, there are some definite differences in how the job day-to-day looks for the nurse, but ultimately when it comes to taking care of the patients, it's very much similar across all 3 of those settings. So
Excellent, awesome. So it's definitely worth noting that anybody new to dialysis, whether you've been a nurse, you know, maybe you're in that RN to BSN program, but it's really important that all of our new nurses, regardless of your experience, we want everybody to start in a chronic or an in-center or a clinic setting, just because it has that team environment, and we'll get into that in the next slide here, but it's really important that that community and that team is there for you, because dialysis is a very, very busy job. It's a very busy environment. And for those of you who really are thinking about ICU, med-surg, that hospital setting, that's that acute. So we call that an IPS RN. And we'll talk a little bit more about an opportunity in a couple slides here. All right, so these roles very, very, very important to the success of a patient's treatment. So I will pass it to Randall to talk a little bit about each one.
yeah, so again, the interdisciplinary team for the dialysis patient is really critical, and having a dietitian and social worker, those are required by centers of Medicare, Medicaid services. So part of the conditions for having a dialysis facility, we're required to have a dietitian and a social worker. And that's because of the psychosocial needs for patients who are dependent on a machine to live. So that's where the social worker comes in. Dietitian, you know, for a patient who is in end stage, you know, renal disease, they have a lot of unique dietary restrictions and needs. And so those 2 are a necessity really to deliver the best possible treatment for the patients. And they work very much alongside the nurses in a collaborative way to, you know, address the needs of the patients. The patient care technician is also really critical. They function primarily in the outpatient clinic setting, although they also will help in home therapies to a lesser extent, and also in the inpatient setting in some cases. And they essentially are sort of like a nurse's aide, but their specialty is in dialysis. And so they're setting up the machines, they're monitoring the patients, they're reporting to the nurse patient status, and they're essentially a support for the nurse to help deliver the patient care.
Awesome, thank you. And can you share a little bit about dialysis RNs and how it's a little bit different, and they learn the PCT role, and you know why that is, and sort of the importance of them learning the PCT role first?
Yeah, it's important for the nurse to understand on a very technical level what the dialysis treatment involves. And it makes sense because the nurse is going to be supervising and ensuring that the care delivered by the patient care technicians is appropriate and to the standards that we're looking for. And so, in order to be able to do that, the nurse needs to understand that level, the very intimate details as far as what a dialysis treatment entails. And so the way our training starts out is that nurses and patient care technicians essentially train together with someone. Well, they start out in the classroom, but then in the clinic setting, they're working alongside typically a patient care technician, and that's really just because they get more repetition and more exposure to that level of technical training, as far as setting up machines and initiating treatments, monitoring the patients, and then terminating treatments. And so to get the amount of exposure that would be needed to get proficient, it just works best that they're working alongside someone who is seeing a lot of volume. So that's how we kind of start things out. And then once the nurses get familiar or comfortable with the treatments specifically, then they'll branch off into the more nurse-specific job responsibilities.
Excellent. Thank you. All right. So for those of you who are not in the RN to BSN program, so if you are not already licensed, if you're graduating as early as December of this year into spring, summer of next year, you would be eligible for our pre-licensed nurse position. And what this position offers is really a good, I would say, anywhere from 1 to 3 month head start in training. So you can start after graduation, prior to taking your NCLEX. You would train at a designated hub clinic, which we have particular clinics that host our pre-licensed nurses, so that you can have the best possible training experience. It's important that we set the pre-licensed nurse up for success. So you would be training in a clinic that is consistently staffed, a clinic manager has been there, a good supportive team, good clinical outcomes. So it's very important to us that the clinic that trains a pre-licensed nurse is that kind of straight A student. And you would be at this particular clinic, for example, we have one in Stoneham, for 15 months. And then at 15 months, we would put you where we need you. So you've had this great training experience. We do give $10,000 in bonuses along the way. It's split up in 3. And then at 15 months, we will put you in a clinic where we need you. And then from there, really, sky's the limit. Lots of opportunities, which we'll get into in the next slide. But if you want to learn a little bit more about the pre-licensed nurse position, most of you received an email from me already. I've put my email in the chat as well, and I have all of your emails. So you are more than welcome to let me know. If you're interested, we can take a look at what location we have close to you. We can certainly consider you for this opportunity. And then for those of you who are already a nurse, and I will say, even if you're a nurse and you're working towards your BSN, we want to make sure that you're super successful through training. So what I always give the caveat is if you're looking for an opportunity while you're in school, we just want to make sure that you can devote 100% of your open availability for the 12 weeks of training. After the training, it's much easier to work around school schedules. We'll talk a little bit about our awesome hours that are not night shifts, no Sundays. But just know that if you are interested in an RN position and if you're already licensed, we definitely need you available full-time, Monday through Friday, maybe some Saturdays for the first 12 weeks of the role. Randall has started as an RN, and I'll let you take it from there. This is a very small picture of lots of opportunities available, but Randall, talk about how you came into Fresenius, what degree you had, maybe you've taken advantage of tuition reimbursement, and what position you're in now.
Yeah, so, nursing was sort of a second, third career for me. And I came into it from a background in working in psychiatry. So initially my goal was to go back into that as a nurse. However, over the course of my nursing training, especially going through the ICU rotation, I really started to look more towards traditional medical type nursing. So once I graduated, I really wanted to get in the critical care area, and it was difficult to get those jobs as a new grad. So one of the things that had happened over the course of my training was I had made friends with someone who worked in dialysis, and dialysis, depending on the patient needs, whether they're in a rehab or they're on a med surg floor or they're in ICU, they need dialysis. And so I've always really enjoyed technology. Dialysis is very tech forward, very tech heavy. And you also get to really spend a lot of time with patients, because, and it is really a unique segment in healthcare and nephrology, because patients, they rely on us and the modality to keep them alive. And so it's probably one of the most invasive and life-sustaining treatments that is delivered in an outpatient setting. But anyways, to back up, I got my start in the inpatient setting in the hospitals, and I found it was a great fit because I was able to work on those ICU floors and take care of the patients that needed dialysis, and kind of satisfied that interest I had in the technology side. But also, dialysis treatment takes 3 or 4 hours, and so you're also able to spend time with that patient, educating them and talking with them and getting to know them. So it really satisfied a lot of interest for me. I did not really want to have a heavy patient load where I was really just spending my time, passing meds and doing documentation, which unfortunately is the reality in a lot of other settings for nurses. So that's how I got my start. And then after doing the inpatient side for a while, I decided I wanted to try the outpatient side. And I really enjoyed that as well. And in the outpatient setting, again, you really get to spend a lot of time with patients, and you get to know them over years in some cases. And that whole time, you're essentially responsible for keeping them alive and helping them, spend time with loved ones, do things that are important to them. And so, it really is a pretty powerful service, to provide to those patients. So, and then, this slide here really shows all these different opportunities within the Fresenius organization. And, after working in the outpatient setting for a couple of years, education position opened up, and I pursued that. I got that position, and then within a year or so, my manager moved up to a new position, and I applied for his position, and so on and so forth. So that's the other great thing about Fresenius, is that because it's such a large organization, and it is vertically integrated, and it is also very heavily regulated by CMS. There's just a lot of positions available. And so as far as advancement or wanting to grow professionally, it really is a great organization for that. So a lot of opportunities for mobility, job growth, and I'm currently working on my master's, and that's I'm using the tuition reimbursement for that. A lot of great benefits on that side too. So
awesome.
Yeah.
So it's definitely worth noting that Randall didn't really have a plan. He came in as an RN, really liked dialysis. He started here. Then he bumped up to the clinic, which now they would be a little bit opposite. You would start in the clinic, then move over to acutes, travel nursing. You know, if you've got the flexibility and want to do short-term assignments, you know, I know you all are in the Northeast and I'm in Chicago, and I would love, you know, a little bit of a nice warm weather assignment. So travel nursing sometimes is enticing. But then he bumped up here to education, and about a month ago, Randall was a regional education manager, and they've recently added and combined because we just keep growing. Now he's over 2 regions and he's at a senior level. So great example of, you know, what an associate degree can get you, and, you know, all the career growth opportunities.
You're too kind, Amanda.
I only say that because I make him present with me often.
Yeah, it's true. It's the least you can do, right? Yeah.
Right. So what we love to brag about, and probably the number one enticing benefit, is our flexible hours. So we have lots of ASN and BSN nurses who come in and, you know, want to take advantage of tuition reimbursement and want to get your BSN or MSN or have things going on in life. So our flexible schedule really offers the opportunity for, you know, spending all that extra time, whether it's with family or other obligations. So typical work week after the training, after the 12 weeks of training, is 3 to 4 days a week, 10 to 12-hour shifts. It's early mornings, but you're done by late afternoon. Sometimes our nurses like, well, you know, they want to do the later shift because they want to, you know, see kids off to school. So we have clinics that have a later shift available. But the great thing is we don't have nocturnal shifts. Those clinics are few and far between. So no overnight shifts, no Sundays, major holidays, Thanksgiving, Christmas, and New Year's, those would be the exception to the Sundays. So Thanksgiving's on a Thursday, so we would close the clinic on a Thursday, and we would open up the Sunday shift, and we would just shuffle the patients around so that everybody can be with their families on those major holidays. And Randall mentioned, you know, something that's important to him is the deep relationships with patients. I can't tell you how many times I've been into a clinic and I hear a patient talking with one of the PCTs or nurses, and you would think that they've known each other for years. And in some cases, that is the case. They've seen this patient come in for many years. A lot of times these patients become your family. And you're really involved in their whole total well-being, because once they're on dialysis, you know, they have a lot of other things going on. So you're not just a nurse giving them a treatment. You're really utilizing those head to toe skills that you've learned in nursing school. So using the chat feature here, I want to know what benefit is important to you all. So maybe it's a health benefit, maybe it's a perk, maybe it's 401k. So using that chat feature, let me know what's important to you. What, you know, coming into a new company, maybe you don't have a particular benefit now, or maybe you do have a benefit available to you and you just love using it. Randall talked about taking advantage of tuition reimbursement. He came in with his associates and now he's getting his master's. So our PTO is also super lucrative. Yes, Carrie. Yep. So time off, paid. Yes. Yep. So for a full-time employee working 40 hours, you start accruing PTO at 30 days. So after your 30 days, which is also the threshold that your medical benefits go into effect. So full-time employee accrues 8 hours every 2 paychecks. And trust me, once you're in training after those 12 weeks, you come out and you look at your paycheck and you're like, whoa, where'd all that PTO come from? So it's one of our very generous benefits that we have available. 401k reimbursement, not a lot of healthcare companies, especially if they're nonprofit, don't offer that 401k, and we do. So that's probably one of our biggest benefits that people love. So wanted to open up, I know we've got some questions here in the chat feature, so let me scroll right back up here and I'll address these. Perfect. Do you have an hourly wage or salary range for the pre-licensed nurse? Thank you for asking this question. So we are not going to penalize you for not having your license. So the great part about this pre-licensed nurse role is we've designed it so that you are coming in agreeing to within 90 days. So for Massachusetts, you would have to pass your NCLEX within 90 days of your start date, which is from all the pre-licensed nurses that we hired last year, that was plenty of time for them to take their NCLEX. So you're coming in at an RN rate. So it doesn't matter if you've already got your license or you come in under the pre-licensed nurse role, the rate is the same. Now the caveat to that is that it depends on your experience. So, you know, we have some students on this call here where they already have their RN license and they're going to their BSN. So somebody who is already licensed or may have previous LPN experience, EMT, CNA, medical assisting, all of that previous experience gives you credit towards that final offer rate. So we don't have a bucket and we don't say, okay, everybody new coming in gets paid X amount, because everybody's bringing different experience to the table. So we work with our compensation team. We take a look at the other nurses at that clinic in the area and we say, okay, well, you know, this person has 2 years of experience and they're at this rate. You know, this person has 10 years of experience, they're at this rate. So every offer is catered to that specific new hire. So I don't have a set amount to give to you, but I will say in Rhode Island and Massachusetts and New Hampshire, all of our New England pre-licensed nurses, when I gave them their offers last year, they were very pleased with the rate. Nobody was unhappy with the rate. So to me, that says a good thing that we're very competitive. Perfect. All right, let's see here. Awesome. And then the other part of that is it more like training for 15 months? Yeah, a little bit. So another piece to the pre-licensed nurse position that we've built just to get that extra community and that extra layer of education support is as a pre-licensed nurse, you come in what we call the nurse residency program. So that program and that extra community and education piece is only offered to our pre-licensed nurses. So we know you need that extra support. You know, maybe you've had previous experience as a CNA or a medical assistant, but you're a brand new nurse, and that's a big change, right? So once you come in, we assign you a nurse mentor, and that mentor checks in with you a couple times a month. They're probably at your clinic. And then we have particular people in education who had the nurse residency program, and they're really there for you as that extra support for that 15 months. We have some extra additionally layered training and education pieces, more check-in points. So it's a really great opportunity to come in and not just, like they say, eat your young as a new nurse or hiring in the masses. So under that pre-licensed nurse position, that nurse residency program would be like that training piece. Someone just asked me about PTO medical benefits and tuition reimbursement. Absolutely. Let me go back one slide here. So health benefits go into effect at 30 days. I would say the one positive piece about our medical benefits that's a little bit different than others is there's different tiers. So if you're super healthy and it's just you, we have like a high deductible and it's a low cost that comes out of your paycheck. So there's 3 different tiers that you can select. Same with dental, same with vision. And then the tuition reimbursement is $5,200 per calendar year, once you're with us for 1 year. So if you're coming with an ASN and you eventually want to get your BSN, certainly we want you to take our money and take advantage of that for us to pay for your school, or BSN to MSN, like in Randall's case.
Can you talk about all the benefits that you have?
Sure.
You talked a little bit about some of them, but I want to make sure you touch on all of them.
Sure. So you'll see here in the top left-hand corner, we have all your traditional benefits, the medical, dental, vision, HSA, depending on your FSA. So that's for your child care, short and long-term disability. Something new for this year was like a kind of a elder care, child care stipend. And that came into effect during COVID. And I think we're re-offering that. I think, Randall, correct me if I'm wrong. I think they're adding that back in.
Yeah, we currently have a child care grant, and then they're looking at doing additional, putting together some additional resources to help support people with child care challenges.
Wow, that's a great benefit.
Yeah. So I would say, I mean, it was very quickly. It was like the Thursday in March where it was like peak COVID in the Northeast. And it was by Friday, there was a company-wide email and our president said, I hear you, it's childcare, give me the weekend. And literally by Monday, there was a plan starting to come into play because and it was a child care, elder care, because, some people take care of family members as well. And, having them work more hours, kids are at home. So that was probably one of the biggest benefit that we saw. In the summer, it did go away. However, they heard everybody and we started to see a little bit of turnover just because kids are going back to school and it's virtual. So they're adding that back in. So that's probably our biggest and new benefit this year.
Another thing I wanted to add is due to the pandemic, they also instituted across the board differential for all direct patient care employees. And then for isolation, we had to set up some isolation clinics for patients who were COVID positive. So staff that were supporting those clinics got an additional differential on top of the across the board differential. So the company absolutely responded to the needs out there amongst that we've all been experiencing this year. It's been quite a year, 2020, but there were a lot of really nice responses to the challenges that people were facing due to the pandemic. And some of those differentials have now been sunset, but the isolation shift differentials are still in place. So fortunately, we don't have a lot of patients that are in isolation anymore, but knock on wood, it stays that way. But we still do have a differential for staff that take care of those patients. The other nice thing about Fresenius, because of just the scale and again, that we're vertically integrated, we really didn't have any interruptions with PPE or any of the supplies that we need for if we're taking care of patients safely. We've had a really, really strong screening process for all patients and staff in our clinics from very early on in the pandemic. And we've also, so we really haven't seen, as far as the increases in incidences of patients with COVID, our patient population hasn't seen the same amounts of increases as the general public has. And I think that's largely because we've been able to really leverage all of our resources to, really deliver really excellent infection control patient care. So just a couple other important things to point out. So.
Absolutely. And from a training and onboarding new hire experience, so we have monthly training classes. So everybody in the United States starts on the same day every month. So everybody's kind of coming in at the same time and learning the same things. But something that was really impressive is we did not stop hiring. Therefore, we did not stop training. So we didn't miss any training classes. All of our pre-licensed nurses, we met a lot of students in the spring who accepted pre-licensed nurse positions, and with lots of virtual interviewing and virtual conversations, virtual tours, they too accepted positions and are doing really, really well. So it was important for us to, not only go to campus last year and sort of spread the Fresenius word, but still offer opportunities and not interrupt training. All right, Carrie, do you have any more questions on your end?
You talk about the organization being vertical. Can you describe what that means?
Absolutely. And Randall, I'll pass it to you for a little bit of this. So vertically integrated, so we started with a dialysis machine a long, long, long time ago. And then we just moved up from there. So from making our own machines to having our own chairside pharmacy services to, Randall, I'll pass it to you, to a lot of other things that we have.
Yeah, and I mean, basically, I think that captures the essence of what that means. Essentially, for all the services we provide, we've got the infrastructure that we've created, either through acquisitions or through just development, research and development, and establishing manufacturing and whatever that looks like. But essentially, everything that's needed to take care of a patient, the company has essentially created its own pipeline for all the supplies and everything that are needed for that. So, the dialysate lines, dialysate supplies, the machines, the PPE, pretty much all of that stuff, we control the production within the organization. And so it's all essentially integrated all the way up through like the supply chains, all the way up to the actual patient, if you will. So I think, does that explain it? Did I capture it? Yeah. Okay.
Yes, pretty much you do everything yourself.
Yeah, we control. And it's really beneficial, especially again because our patients can't go very long without a treatment. So they really depend on us. And this is another important point that we didn't really touch on. But whenever there's a natural disaster, a hurricane, or floods, earthquakes, you name it, we have a very robust disaster response team, and that also applies to our staff because the patients need the treatment, so they need staff to provide those treatments. So, we have warehouses full of generators and mobile homes and all kinds of things to help support staff in the event that they're affected by a natural disaster, and so that we can support them so they can then also take care of patients. So, having control over all the pieces needed, it just ensures that we can follow through and deliver for the patients, despite what the challenges might be. So it makes sense from an organization standpoint that we have control over as many of those variables as possible. So.
Another question I have is, can you talk a little bit about the application process, what people can expect from the process, and then any insider tips of do's and don'ts in interviews and application materials?
Yes. So whether you're an RN and you're looking for an opportunity now, or whether it's December, or whether it's a year from now, I always welcome students to email me, regardless of where you're at with your ASN, BSN, MSN, just because there might be an opportunity now, or I might guide you to a next step closer to the graduation date. New England, we are not short of opportunities. We're very condensed with a lot of clinics very close to each other. So the application process would be, it's about 20-30 minutes. So take some time to where you're, in a good spot and you can't be interrupted. So it's an application. There's a short assessment tied to it as well. And that helps us learn more about you in just that brief, recruiter interview, that brief 1-hour interview that your clinic manager has with you. So it's like getting to know somebody a little bit more before the first date. So you have a little bit more info about them, and that's what that assessment helps us. So the first interview would be about 20-30 minutes with the recruiter. We'll take down some information. That would be phone. And then your second interview would be virtual right now until we can allow visitors in the clinic, which it will be a while. So the virtual video interview would be over Microsoft Teams. We would do a first interview with the clinic manager. The due to the video interview is probably what you all experience in virtual learning. Do be prepared, dress professionally, make sure that, you're in a nice quiet space with the door shut, although I did hear my dog barking downstairs. So it's definitely worth noting to be in a quiet space if you can, to not have interruptions, good Wi-Fi. Even if you have to step away, I've had people step away in their car, which is totally fine. It was a private area, and they could give a successful interview there. Come with questions. We throw a whole bunch of information at you from a presentation and your time with the recruiter. Bring questions to that clinic manager, because it's a time for you to sort of interview us as well and see if it's a good fit for you. We would much rather know if it's mutually a good fit during the interview process than have you come in and, you've invested time and changed family schedules around, and you start and you say, oh, this is not for me. So, we want to make sure mutually it's a good fit. So come with questions. And then there might be another interview layered. It really just depends on that particular area. So I'll give an example. Our North Mass area, you would have a second and final interview with Amy, the director of the area. She definitely likes to meet with all the candidates, and sometimes she'll do it with her clinic manager. So sometimes if we can make it work, they'll join a Teams interview together. But scheduling wise, sometimes those have to be 2 separate interviews.
Great, thank you.
Yeah.
And application materials is just completing the application online. There's no other documents that have to be submitted.
Nope. And there's an opportunity for candidates to attach a resume, and that's really important for you to add on there, because we know sometimes when you're filling in the work history on an application, things get bumped around, dates are a little bit off. So that resume is really important for us to get a good snapshot of your work history.
We do have a question in the chat, which is that if a student is going to graduate May of next year, how soon can they actually apply?
Yeah, so if you're interested in the pre-licensed nurse position, you can apply tomorrow. You're welcome to apply whenever you're ready. The great part about our pre-licensed nurse position is we get you through the interview steps, and we don't make you wait to see if you get an offer. We move very quickly because we know your last year is super stressful, especially fall with those clinicals. So you will have an offer in hand. Probably by the end of, I would say, your fall semester. So the pre-licensed nurse interview steps is a phone call with myself, and then we set up an initial interview with the clinic manager, just like what we talked about, our traditional recruitment process. And then within a couple of weeks of your first interview, if you're selected, we actually do as best of a final interview day. We try to virtually roll out the red carpet. We mail you some gifts, some Fresenius swag, and then we have a virtual experience to where you meet your potential new manager and their leader, and then you do a final video interview. So all in all, I would say could be anywhere from 2 to 4 weeks from your initial interview that we complete that final step. And then after that final interview day, you would have an offer in hand within a few business days. And even if you're not selected, you would hear from me rather quickly. So I follow up either way. So we don't make you keep guessing. So essentially you could have an offer by the time you end your fall semester, and it would be a future dated offer. So we call that a forward facing offer. So it would look just like a permanent offer letter. It would just have a date of June 2021. And then when we're within about 90 days of that start date, I would send you another permanent offer. You'll have that official start date on there.
Thank you.
Yeah.
I just want to mention that if anyone would like help working on their resume, you can make an appointment with our office at curry.edu/ccdappt. And I'm putting that in the chat now. Do we have any other questions? Okay, well, it looks like we do have Amanda's email address in the chat. And so any of you that are interested, please reach out to her to let her know that you're interested, and she can, take you through next steps. And she also has your contact information, so I'm sure she will be following up with everyone on this call just to see if you have any, further questions, and, hopefully just to be able to stay connected.
Absolutely. I will send a follow-up email by tomorrow. So we're here. We're here virtually if you have any questions. And thank you so much for joining us.
Thanks a lot for being here. Have a great night, everyone.
All right.
Thank you.
Take
Thanks,
care.
everybody.
Thank you.